So you must be getting these harassed parents or even the calls from teachers. Now what to do about this ADHD child? Then what is this ADHD? So the definition, the typical book picture definition is it's a neurological condition that involves problems with the inattention, unable to focus, and hyperactive impulsivity that are developmentally, this word is important, developmentally inconsistent with the age of the child. To explain, in a very early toddler, a 1 to 2 years child being hyperactive or overactive is a normalcy. But the same hyperactivity at 7 years is a problem. So that is the developmentally inconsistent with the age of the child. So that goes by the definition. So what is the prevalence? Why we are talking about ADHD? Because the number is too big. In children, it is 5 to 10%. And there was previously thought that ADHD is not in adults. But surprisingly, adults are also 2.5% when it comes to ADHD as a problem which they are having. Obviously, the males outnumber most of the disease, developmental problems. Males outnumber females, and when it comes to intelligence, probably it is the reverse way. But the males outnumber females at a ratio of 3:1 in children, but in adults, surprisingly, the number is same. So it is 1:1. So if you find in adolescents and adults, it is not only boys who are at problem. And it is surprisingly seen, and I have observed by myself also, that our child development centers, the commonest reference is 50%, and that is of the ADHD. And that is surprising. And why surprising and why useful? It is treatable. It is, we can help the child a lot. It is not like autism. It is not like mentally challenged children. It is a problem which can be tackled bravely and beautiful. So with that concept, let's go ahead. How it occurs, how ADHD comes. Now let's go by the neurology of ADHD. So it starts with genetics. Now I understood this point. Everything is genetics. So there is some reason with the genes, and there is something going in our genes. So it runs in families. So you find a typical hyper, a bit aggressive father and the child who is moving around in your OPD. So you find a child who is in OPD, look at the father, you find that the father is also having the similar traits in his mind. He is unable to sit in the place when you are asking the mother. It comes with the issues start with there are multiple genes, it is a multifactorial genetic combination. There is no one single gene which says this is ADHD. Surprisingly, the prematurity, birth injuries, all are associated with ADHD. So it is one of the very important part. Those who are running a big NICUs, remember that when you are managing a premature baby, you are probably having one or other ADHD coming in the picture at a later date. Maternal alcohol, tobacco, lead exposure are also known in the literature. So for us, that prematurity is important. For us, the running in the family is important. Now, let's know the brain part of it. The whole seat of ADHD is Atamaji Satakli. So you are aware of that Singham dialogue. So this Atamaji Satakli is the problem of ADHD. The prefrontal cortex, PFC, we all are fond of this short form. So PFC is the prefrontal cortex which has got a rational control over the conditions, while the basal ganglia is the emotional brain, the limbic system. So it is a problem between these two areas where the ADHD comes in picture. But it is only structural? No, along with that there is a chemical part of it. So it's a dopamine pathway which is disturbed in ADHD, and that causes, now is a very tricky word to understand, failure to suppress the inappropriate response. To explain it in a very different way, let's imagine that there is a school, there is a principal who is strict, there is a teacher who is very lovable and she is very much connected with the children, and the children are typically are hyper and over enthusiastic children. Now, if the principal is there in the school behaves properly and the school is calm and quiet and everything goes smooth. But if the principal is on for leave, that lovable, enthusiastic teacher and the children will all enjoy the fullest of the class, and the class will get disrupted. So here the principal is the prefrontal cortex, while the lovable, enthusiastic teacher is the basal ganglia amygdala. Amygdala is the center of emotions. So these children, our brain, is not controlled by the principal, the prefrontal cortex, and the child becomes hyper and inattentive. So that is the way the pathophysiology of ADHD comes, and that is the way Why it is that prefrontal cortex is now dull, it is not working in ADHD. And now we'll understand why we are going to talk about the stimulant medication in a stimulated child. The reason is over here. Now let's go ahead with what happens. Because we cannot control that response, the child lands up in executive function problems. Executive function is the orchestration of the brain. The child cannot regulate himself, and the child lands up in a ADHD platform. Now obviously the classic three cardinal signs of ADHD are inattention, hyperactivity, and impulsivity, but in various grade. So it is like typical chips and Cheetos with a different taste and different tangy flavor. So ADHD comes with different flavors, and the flavors is a combination of these three things. Obviously, because of that, what goes wrong? The social and academic development of the child goes wrong. This hyper irritable and non-attentive child is a problem for the teacher in the school, and then the scholastic performance goes down. In the society, the child is not accepted, and that it continues. By the time child goes into the adolescent part, the child lines up with oppositional conduct disorder and many more things which we'll be discussing in the next future. Now, everything comes with a diagnostic part. Medicine comes with not only a picture of complaints, it is diagnosed in a framework. And the framework which is applied in all those developmental disorders is DSM-5 criteria. So what has changed over the period? The first thing we should remember, all these complaints should be persistent for more than 6 months. That is first part we should remember. Now, till now, ADHD was taken as a disease to be diagnosed before 7 years of age. But now, the DSM-5 has broadened the definition to less than 12 years. So, there are some children who may be diagnosed even at 10 years of age and who may be presented at that time. Now, there are multiple symptoms. So, the symptom number is complex. Inattention, there are 9, and hyperactive impulsivity, there are 9. In a previous one, it was 6 out of 9 for children, and now it has added that in adolescents, it is 5 out of 9. For adolescent, they give a little bit of a concession. So 5 out of 9 is also enough to call it a inattention or hyperactivity. And now this is used as a combination of things. So the child may be having only inattention presentation, or only hyperactivity impulsivity presentation, or a combination of the combined inattention hyperactive impulsive disorder. So that is how the presentations are defined. And what is important, this should be associated with two settings impairment. The child should have problem in the academic, the child should have problem in the socials, and even the occupational way. And importantly, it is not associated with other psychiatric disorders. So that is how the definition of ADHD comes. Now you will say, doctor, this is too much. How we can remember these things? Now let's go over some pictures. So the inattention part comes with 9 of the list. So it starts with carelessness, doesn't listen, and all this. Instead of looking at the plain simple words, let's look at something. So the details. The children miss the details. So often they fail to give close attention to the details to make careless mistakes. So classically what happens? The child is asked to write 3 and he writes 8. Or other way around. Child is asked to read a number, he instead of 8, he will read 3. So details are one thing which the ADHD children lose. What second thing that goes wrong? The children are unable to focus on things. So the teacher is teaching something like that. For example, I am talking a lot, and if you are just looking at the IPL at the same time. So that is inattention. The child is unable to focus at that time. There is difficulty in remaining focused during lectures, during conversations, lengthy reading, and thanks to this COVID, especially this online teaching, this inattention has been added even for a normal child. So this particular difficulty in remaining focusing is now not only the sign of ADHD, the next DSM-6 will be saying, and not involving the screen media abuse. So we'll be adding that problem at a later part. So that is the inattention second sign. The third sign is when the people are talking together, the children are lost in their own thing, but they are not autistic. They can focus on what they think, but they're not. It is that not unable to connect. They're able to connect, but they're still the mind seems elsewhere. Khayalon mein, that is a typical word we see about the ADHD children. So teacher says that ये बच्चा ध्यान ही नहीं दे रहा है अपने classroom में, and that is inattention. What is another thing they said? They are unable to finish. They start bravely. They start the task, and somewhere on the time they get some distraction and they leave the task. So they're unable to finish. A classic, I will say, Indian phenomenon. They will start the things bravely and then they will lose it in between. So that is another feature of a ADHD child. And that happens even in the adulthood also. They don't complete their duties in the right way. The children are having a lot of difficulty in organizing their task and activity. So the table is a horrible mess. They can't find their pencil, they can't find their sharpeners, and they're in a total disorganized way. And this disorganized child who is unable to focus, you are aware that you are managing a inattentive child. This inattention also adds to that they avoid tasks that require effort. So for example, a child is asked, he may be good at it. The child is asked to play chess. वो बोलता है क्यों इतना झंझट ले लूं, एक चेस में बहुत दिमाग लगाना पड़ता है. Even though he is very intelligent, because it requires constant effort, the child won't like to do it and he'll avoid that task. Similarly, the older adolescents and adults will avoid the paperwork which requires again a consistent look at it. Another way to look at an inattentive child, they often lose the things. The mother of a ADHD child, if you ask her carefully कि क्या होता है उसके कंपास बॉक्स का, the mother will 110% she will tell you that डॉक्टर साहब हर महीने एक डजन पेंसिल्स खरीदनी पड़ती है, उससे भी ज्यादा इरेजर्स खरीदने पड़ते हैं. So tendency of losing the things, and that is a classic finding of ADHD child. Why I am telling all this? Can't we ask this thing very easily in our pediatric OPD? I say it is very easy. The only thing is the mind should see the way it is looking at. Another thing is they're very often easily distracted by minor stimuli. So the child is focusing on what the teacher is saying, and somebody goes outside the window, and the child will look at it. So I always say that this inattention ADHD children are like typical those college heroes who are flirting with 10 girls. So they are typically inattentive, distracted by minor stimuli. So that is again a classic of a ADHD child. And in adults, again the word I again go come back to the word ख्यालों में, वो अपने ख्यालों में चले जाते and they're inattentive and they get distracted very quickly. So that is eighth part of the inattention. And lastly, they're forgetful. उनको बोला जाता है कि भैया आप जब नीचे जा रहे हो बच्चों के साथ खेलने, आते वक्त कुछ फ्रूट्स लेके आओ. तो खेलेगा खेलेगा कुछ और करेगा लेकिन फ्रूट्स लाने को भूल जाएगा. Typical forgetfulness is a classical inattention. Obviously, this forgetfulness is a common feature of pediatricians also. So, most of the time, pediatricians come to the same problem because we are lost in our clinical pictures. Adults, they forget about responding to the call, paying the bills, keeping the appointments. Everything fits into the inattention. So, these 9 things come with the inattention. And I'm very sure now nobody can miss them. The only thing what you require, you may require a checklist in your hand to find out this. So first diagnostic part for inattention is you have to select out of 9, 5 or 6. Now let's go for the hyperactive impulsivity. Again, I won't go through this long list. Let's go one by one. So these children, if they are on the sitting on the table, they will continue to tap on the thing. Their feet are moving. They're not steady in their seat. They're always moving, and that is a classic sign of a hyperactive ADHD child. Another side is the child is at this moment is sitting in his place and अगले moment वो चला जाता है. And again, this is leaving his place from his classroom or in the adult or adolescent or from the office practice. A very classic diagnostic part of hyperactivity. These children are just running around and climbing, and in the thing whether it is very risky or it is inappropriate. But यहाँ पे the one thing to warn about, especially those who are having interest in developmental pediatrics, ये running about is also confusing with autism. फर्क कैसे करेंगे? A child with autism will run purposelessly. A child with ADHD, उसने आपने क्लिनिक में देखा कि वहां पे डॉक्टर का स्टेथोस्कोप पड़ा है, तो मम्मी डॉक्टर को अपने को इंट्रोड्यूस कर रहे तब तक वो बच्चा जाके अपना स्टेथोस्कोप लेके भागने वाला है. So those who are proud about their lit ones, they are aware that hyperactive ADHD child can create a problem with their stethoscope. Classic finding that running around for a purpose. Autism, they won't run out for a purpose, they're running purposeless. Adults, these people can't sit in a place. They're always moving. They're always feeling restless from within. They may be sitting because of the social norms, but अंदर से उनको restlessness रहता है. They want to move, they want to do everything. So that is third part of hyperactivity. उनको एक प्रॉब्लम रहता है ये बच्चे बिकॉज दे आर हाइपर, जहां पे रूल्स आते हैं, जहां पे एक दूसरे के साथ इंटरेक्टिव खेलना रहता है, दी चिल्ड्रन डोंट लाइक टू प्ले. सो दे आर अनेबल टू प्ले और एंगेज इन द लीजर एक्टिविटीज क्वाइटली. दूसरे बच्चे खेल रहे वो उनके बीच में जाएंगे, डिस्टर्ब करेंगे. सो दैट इज क्लासिकल फाइंडिंग अबाउट दीज किड्स. सो दिस वन थिंग विच वी वांट टू रिमेंबर. फोर्थ पार्ट ऑफ इट, व्हाट इज द फिफ्थ पार्ट? ये लोगों को क्या रहता है कि उनको पीछे से किसी ने मोटर लगाया, so they're always moving. तो एक जगह पे बैठे ही नहीं सकते, अनेबल टू सिट स्टिल, एक जगह पे भी वो बैठने वाले नहीं है, दे आर ऑलवेज ऑन द गो. We call that they are always having a motor behind them, and that is a classic finding of a hyperactive child. Okay, the hyperactive child, they are always, the hyperactivity is not only in the movements, the hyperactivity is also in their talking. So that chitter, they're called as a chatterbox. Teacher बोलती रहती है ये बच्चा पूरा क्लास बड़बड़ करता है. So that is a classic sign that this is hyperactivity in speech. Hyperactivity is not in the legs also, it is also in the speech. So that is another way we can look at it. There, now these are the 6 parts of hyperactivity. What about impulsivity? तो उनको पूछना शुरू होता है टीचर का, एंड दे विल ब्लर्ट आंसर, टीचर टीचर आई वांट टू टेल. पापा कुछ बोलते रहते हैं, पापा का सेंटेंस कंप्लीट होने के बिफोर द चाइल्ड स्टार्ट्स विद ब्लर्टिंग आउट द आंसर. Impulsive child. If they are playing on a garden and the children are just going on a slide, so these children with ADHD, they won't wait for the turn. They will butt in, they will push somebody else on behind, and they will go in. So these are the typical impulsive characteristic of ADHD child. That's the way. अगर आपको बस की लाइन में, स्कूल में लाइन से जा टू गो, they won't stop in their place. They like to go ahead and ahead. They can't wait for their turn. They can't wait. That is a problem with impulsivity. इनका और एक खासियत रहता है, दो बड़े बोल रहे हैं, दो बच्चे बोल रहे हैं, ये बीच में आएंगे, बड़बड़ करेंगे, पापा आप क्या कर रहे हो, मम्मी आप कर रहे हो, मम्मी पापा दोनों का दिमाग खराब हो जाता है. सो दे इंटरप्ट अदर्स. ये आपको अपनी ओपीडी में, नाउ दिस इज अ पॉइंट फॉर अ पीडियाट्रिशियन टू नोट, दिस वन थिंग आई हैव कॉमनली सीन एज अ डायग्नोस्टिक क्विक मार्कर फॉर एडीएचडी चाइल्ड. तो मम्मी के साथ हम बोल रहे हैं, पापा के साथ बोल रहे हैं, ये बच्चा बीच में आने वाला है. So watch your stethoscope and watch your conversation, and you pick up the ADHD. So that is why I'm telling, we can pick up ADHD in our very fast, whether it is a high 50 patient OPD like you all Rajasthan Royals, I'm very sure. But आपको कितने टाइम निकालने का है? Only 2 minutes. In 2 minutes you can pick up. Now 2 minutes you can remember the Maggie noodle वाला pattern. So I am remembering those 2 minutes to remember for developmental pediatrics. So developmental pediatrics आपको कितना देना है अपने practice में time? 2 minutes only. And in 2 minutes you can pick up ADHD, you can pick up autism, you can pick up mentally challenged children, you can pick up learning difficulty, you can pick up communication problems, you can pick up behavioral problems as well. Time कितने लगने वाला है? 2 minutes. And you can now write it down over here with this COVID and what are happening. 5 years down the line, you will find the mental and all these development problems equaling with the physical problems. And हम सबको तैयार रहना है कि by next generation we are supposed to get prepared to the mental and psychosomatic problem as equal to the physical problems like all sepsis and all that. So now a time will come जितनी ICU चलने वाली है उतना डेवलपमेंट का काम चलने वाला है. That's what I'm looking into the future and be prepared for that. So the diagnosis comes as a predominantly inattentive presentation, as the DSM-5 say, or the presentation word that is predominantly hyperactive, impulsive, or a combined type. So we can diagnose this with the combination of these things. Now once we have diagnosed that it is ADHD, how to go ahead? तो आगे जाने का प्रॉब्लम है. Now we remember, is ADHD a problem with children? No. Especially, I am very happy to discuss this problem on the platform or adolescent society, how it goes over the lifespan. तो अपने प्री स्कूल में इनअटेंशन शुरू होता है. प्री स्कूल में इनअटेंशन ज्यादा दिखता नहीं क्योंकि उनकी रिक्वायरमेंट ज्यादा नहीं रहती. बट इनअटेंशन गोज एज द चाइल्ड अप्रोचेस द एडल्टहुड. Second part, the hyperactivity, surprisingly, the preschools and children, it is high. And by adolescents, ये कम होने लगते हैं. तो लोगों को लगता है ADHD चला गया. But ADHD doesn't go. It remains in some different perspective. So it goes down with the hyperactivity. Impulsivity का क्या होता है? वो adolescence में बढ़ता है. वैसे भी adolescent बच्चे impulsive रहते हैं. All those AHF people will agree with one line together that impulsivity is a classic finding of an adolescent child. तो ये एडोलेसेंस में इंपल्सिविटी बढ़ती है, उसके साथ एडीएचडी ऐड हो जाता है और एक से भले दो करके वो बहुत ही बड़ा ब्लास्ट हो जाता है. सो इंपल्सिविटी इंक्रीजेस इन बाय एडोलेसेंस. द थर्ड पार्ट, द मूड, द फोर्थ थिंग, दिस इज समथिंग मोर देन द टिपिकल एडीएचडी प्रेजेंटेशन. द मूड स्विंग्स, they are added now as an extra feature in the adolescence and adulthood. So this is how the ADHD presents in the whole lifespan of a child. इसका और डिटेल में देखने जाएंगे तो लेट्स see the continuum of it. How a preschool child will come? This child is typically irritable, overactive with behavioral disturbances. So toddler, can we find a ADHD early diagnosis? We can. These are overactive children. These are always on the move. They're restless. They can't stop. मम्मी टिपिकली बोलती है कि खाना खाते वक्त भी ये एक जगह पे बैठते नहीं, सिर्फ टीवी उनको बिठाता है, बाकी सबके लिए वो दौड़ते रहते हैं. सो यू मे थिंक दैट द स्टार्टिंग ऑफ एडीएचडी मे बी इन द प्री स्कूल टाइम. फिर स्कूल एज में सबसे क्लासिक डायग्नोसिस रहता है, बिहेवियर डिस्टर्बेंसेस रहते हैं, एकेडमिक प्रॉब्लम्स रहते हैं, सोशल इंटरेक्शन में दिक्कत आने लगती है. एंड बिकॉज द चिल्ड्रन कैन नॉट कनेक्ट विद पीपल बिकॉज ऑफ देयर इनअटेंशन, उनके सेल्फ एस्टीम के इश्यू शुरू हो जाते हैं. द चाइल्ड में बी इंटेलिजेंट, चाइल्ड में बी वेरी शार्प, बट उसका खुद का कॉन्फिडेंस चला जाता है. क्यों? टीचर बोलती रहती है, मम्मी बोलती रहती है, पापा बोलते रहते हैं, पूरी दुनिया उनको एक जगह पे बिठाने पे रहती है. And then felt desperate or frustrated about themselves. That is a classic finding with ADHD. Adolescence में क्या हो जाता है? These children, they ये तो everything continues, but now is a time that they land up with self-esteem issues, conduct disorders, opposition-defined disorders. These children are the children who may land up in smoking, addictions, substance abuse, and if the children are allowed to drive or something, injuries and accidents are going to be them with these kids. So especially juvenile delinquency may be associated with ADHD. And surprisingly, if you are able to pick up that ADHD at that time, we may solve these bit difficult topics. What goes in the adult? Now, yeah, these children, because of their strong commitment to a point, they can't focus on the occupation. They have to lose their jobs. They may not get good jobs. They continue to have self-esteem issues. उनके marital discordance भी रहता है. They cannot manage well with their spouse, and the whole relations are get disturbed. The legal issues, addictions, injuries. These it is proved that in ADHD the risk of road traffic accident quadruples as compared to the normal individual. So that is how it is in the continuum. ADHD comes with lots of issues. One of the biggest issue with ADHD is learning difficulty. To that extent that in the now the specific learning difficulty definition, one of the part of LD is ADHD LD. Now ADHD is becoming a part of LD as a diagnostic part. So that's how the learning difficulty is now associated with ADHD. And LD, people are not much aware than ADHD thanks to Amir Khan's Tare Zameen Par. So लोगों को लर्निंग डिफिकल्टी ज्यादा पता रहती है, बट वी डोंट नो द एडीएचडी पार्ट ऑफ इट. आई रिक्वेस्ट नाउ, आमिर खान ने कर दिया तो अभी शाहरुख खान को बोलना चाहिए एडीएचडी पे काम करो. सॉरी, उसने ऑटिज्म पे काम किया है तो एडीएचडी किसी और को बोलना पड़ेगा. तो दैट इज हाउ द एडीएचडी इज इंपॉर्टेंट. The next part is oppositionally defined disorder, again common with ADHD, especially in adolescent age group. Oppositionally defined means क्या? They're always in the fighting mode. That's a simple thing to remember at this particular moment for the time being. तीसरा part है, because the children, they are intelligent, they want to do things, but they can't continue. And that adds to the anxiety. So generalized anxiety disorders, separation anxiety disorders are very commonly associated with ADHD. उसके साथ क्या रहता है? These children have problem with the conduct. There are always some issues with the behaviors, with the teachers, with the adults, with the peers, and they'll end up in issues with them. That's the conduct part also, which is very important. These children are also having tendencies of habits. From habits right up to tic disorders, ADHD is commonly associated. So they may have some eye blinking, they may be having some throat clearing, so many things, right? Like tics, like putting out the shoulders, moving with the fingers. All these habits come associated with ADHD. And typical mood disorders. So these children, they're quite at they're quite calm at one moment, and the next part they become impulsive and they land up into a mood disorder. So that is another common comorbidity or association with ADHD. I wanted to clear this concept of comorbidity. That means they're associations. They're not the differential diagnosis. So what is the differential diagnosis? LD itself is a differential diagnosis. So learning difficulty itself is something different, and we should not be comparing that with ADHD. Well, what is more than that? Autism spectrum disorder, the typical impulsiveness, the typical restlessness, moving around is classic with autism as well. How we are going to differentiate? ADHD children, they want to connect, they want to interact, they want to communicate. Classic with ADHD, they want to connect. And autism, they just don't want to connect. तो उनको connect नहीं रहता. In ADHD, the children are moving with a purpose. They want something to snatch. They want something to get. In autism, they're purposeless in their movement. In ADHD, they're blabbering a lot of speech. Autism, poor speech. Mentally retarded children, or nowadays it is called as an intellectual disability. They may also be restless and moving because they don't know what to do. But with a few minutes of dialogue, you will understand they cannot answer simple questions. They don't have logical reasoning. Well, ADHD, logical reasoning is perfect. They are very good at it. So we can find out that logical reasoning is one way we can differentiate mental retarded or intellectual disability child from ADHD. The movement disorder, chorea and ADHD. What you will find in a movement disorder? A typical pattern in the movement. Well, in ADHD, the patterning changing. They are like typical butterflies, so they can't continue with the same pattern. While a chorea movement disorder, you'll find a pattern in their movement. Epilepsy is absolutely way different, but ADHD and epilepsy are also sometimes associated. And unfortunately, the medications used for epilepsy are associated with bit of inattention. So we should be careful about it. A hyperthyroid child, they come with restlessness. So they're thin, they're having tendency of loose motions and all that, and they're at the same time restless in their picture. How are you going to differentiate with from ADHD? You'll find out that ADHD is ऐसे उनके all parameters fit नहीं होते, so we cannot complete the diagnosis. How many parameters? Only 18. So you have to got 18 questions, and we know ADHD in our way. Drugs like theophylline, a very common story. Theophylline, amphetamine, anti-epileptic drugs all come with a part of ADHD. Forget about theophylline, which you are not using now. But even salbutamol, pure salbutamol, not levosalbutamol, comes with irritability and restlessness. And surprisingly said that it is ADHD, and it won't up once the drug is stopped. And in adolescent, a child who is calm till now suddenly becomes impulsive, inattentive. It may not be ADHD, it may be a substance abuse, and you should be very careful with these particular children. Now, what next? When we are aware of the comorbidities and differential diagnosis, we should be also aware of the complications. So, complications are two many. The first one is academics. They can't complete, they can't, and unfortunately, ADHD is not listed as like a mentally intellectual disability or a learning difficulty. So, these children don't get any advantage in the exams. So, we have to be very clear. ADHD children, they don't get an advantage of say 10 minutes or using a writer is not allowed for ADHD. Social problem, they're always socially unhappy, they're not socially well connected. So children keep them away. So peer rejection comes with the children. And if you find just go through the list of the criminals, you'll find this tendency of ADHD and criminal activities is well associated. Inferiority complex, because the children are always targeted, that bullied by other children, then they'll end up in inferiority complex. And because the children having ADHD, they may end up in a disturbed family background. Especially adolescent ADHD is a difficult combination to treat, and the whole family get disturbed. And once the person becomes adult ADHD, there is another disturbance in the family which can picture come in the later of the picture. So the complication. This all tells that we need to work on ADHD well. How are we going to diagnose it? Diagnosis is very simple. That's what I'm saying. We need to ask the teachers, we need to ask the parents, and I tell you that we parents and teachers will voice these complaints without you asking them. You ask wala wala ana Sonia kaise behave kar raha hai, and the teacher will start blurting out, these inattention hyperactivity signs automatically, even though she is not aware of your question. But what we need to do, we need to be giving a structured clinical interview. आपको पता है यार, ऑल पीडियाट्रिशियंस को पता है कि किसी मम्मी को बोलने को दिया तो वो रुकती नहीं. And that is why we need to be very careful while diagnosis ADHD. तो वहां से हमें we need to select the right answers to combine for the diagnosis. And we need to ask for the parents for the behavioral observations at home, as well as ask the teachers for the behavioral observations at school. So these three things are the diagnostic tool, and we have to be careful about it. But most important thing we should remember is, most of the time we might make this problem because we are just talking to the parents, especially when it comes to adolescent and which is a bit older children. Don't forget the child. Mummy papa ko bahar bhejo. Just talk to the child. the child has also a lot to tell about his parents. And जब वो child अपने parents के बारे में बोलता है, खुद के बारे में बोलता है, that gives the perfect diagnosis of what the child is going through. And you can disappear from the differential diagnosis of the ADHD by talking to the child and not only to the parent. So the three people you should be asking: teacher, parent, and the child himself. And that's all keeping the diagnosis. Assessments, I think that is the area where we developmental pediatricians come in picture. But those who have got time to spend on such things, these scales like Vanderbilt, CBCL, Connors, they're not very difficult to gain, or even DSM-5 ADHD criteria is a diagnostic and is a golden measure to diagnose ADHD. कितने questions पूछने के? 20 questions. Can you spare that much time for you? Definitely. And your parents will know, oh, my doctor has interest or in my child and he knows my problems. And this has happened quite a many times that mother comes to you, doctor इसको कुछ करके सुला दो, इसको शांत करो, and we prescribe something like cyproheptadines and phenergan and try to make the child sleep. We are missing the diagnosis. So that is where the assessment comes in picture. I want you, all of you, to be well versed with this DSM-5 ADHD criteria. Just give it a Google and you'll get a Nelson में दिया है. So, but common mistake we do is उस बच्चे का बहुत अच्छा नाम रहता है, वो कहाँ पे विराट रहता है, कहाँ पे अनुष्का रहता है, वो नाम छोड़ के हम उसको ADHD का बच्चा बोलने लगते हैं. So assessments are not meant to label the child. Assessments are used to plan and enable the parents and child to manage the disease. So that is where the assessments come in picture, and these assessments have to be done regularly at frequent intervals to know whether the child is going into a remission or relaxing, or the child is increasing with the problem. What are the investigations? The first answer is there is no investigations. But over the years, I had known that one of the child was inattentive, not because he was ADHD, but because he was unable to see on the blackboard. Another child was inattentive, not because of ADHD, but because of hearing problem. So make it sure that the child is able to listen, child is able to see. Basic to think, especially in the childhood. For by adulthood, it is quite clear, but in children, it is to be diagnosed very quickly. But there are some areas where the investigations play interesting role. Let's know for the anemia. If you are finding a child with anemia, iron deficiency comes with inattention and overactivity. It may not fulfill all the 9 and 9 complaints, but it will give you a pickup of the hyperactivity by just doing the hemogram and iron status. If you find a child with hyper or hypothyroidism, we need to think of thyroid function test. इन वेस्टर्न कंट्रीज अपने यहाँ पे तो इतने सारे एक्सपोजर्स है, तो अपने को लेड का ज्यादा नहीं, हमें और कुछ भी एक्सपोजर, बट ब्लड लेवल्स has some association with ADHD like presentations. Now this MRI brain and fMRI is for neurologists, and my request to my dear parents कि MRI brain के खर्चे में उस बच्चे का 6 महीने का थेरेपी हो जाता है. So a remedial teacher can be just procured at the cost of that MRI brain. So my request to my dear pediatric colleague over here, please don't go for this medical screening tests or imaging for ADHD. That is not required. I request you for remember that. Okay. How we can rule out some other diagnosis? A very different set of ADHD like presentation is a gifted child, very intelligent child. वो अपने क्लास से भी ऊपर रहता है. इसका क्या रहता है, उसको क्लास में जो चल रहा है उसमें इंटरेस्ट नहीं रहता, and he starts behaving like ADHD. Is he ADHD? No. IQ test will pick up that. Learning disability itself can be a differential diagnosis, and we need to go for the academic or perceptual testing of that child. Again, a psychologist will be in the picture. Neurological conditions, Tourette syndrome, seizures, all require EEGs and all that. And behavioral or emotional problems caused by anxiety. Anxiety itself can present with restlessness and inattention. A very good history, personality testing will give the diagnosis of that. Now, let's come to the management part of that. If I'm bored you till that time, I'm not going to bore much. For next few minutes, we'll be coming with a conclusion. But यहाँ पे मुझे बोलना है कि management is not single line. Management is not only medication. Management is medication, the academic individualized education plan, the behavioral management plan, and the diet therapy. Medications, we have got 3 groups to remember: the stimulants, non-stimulants and antidepressants. I'm not going to bore you with the pharmacology here, but I wanted to address the part about the stimulants part over here. मैंने पहले जो बोला था कि it is the आता माझी सटकली prefrontal cortex, and prefrontal cortex क्या कर रहा है? It is not controlling the brain because वो सोया हुआ है. So I want people to go back and see Singham again because Singham explains ADHD beautifully. तो यहाँ पे वो कमिश्नर सो रहा है, so the prefrontal cortex ये सो रहा है, and we have to trigger the prefrontal cortex, and that's how the stimulant comes into picture. The non-stimulants, atmoxetin, I will discuss, they work on a different platform and they work at a more of a neurological level. And antidepressant, especially if you are finding the anxieties and other behavioral disorders associated, but they are required much less as compared to anything else. What is very important is psychoeducation, classroom management part, summer program. This is something very interesting to tell over. I'm going to discuss it in a few minutes. In medications, we have to remember the two main drugs, the methylphenidate in the first group and atomoxetine in the second group. For the rest of the drugs, either they are very difficult to make available or they are creating issues. For example, clonidine, you must be remembering this clonidine associated with blood pressure and cardiac drug. So better not use these other drugs because they come with lots of issues. But methylphenidate, you should be very well aware of it and start with a very small dose. यहाँ पे ज़्यादा थोड़ा सा काम करना पड़ता है because methylphenidate has a risk of addiction. So methylphenidate is a schedule H drug. So if you start writing methylphenidate, पहले तो नेक्स्ट जो केमिक्स के बारे में मिलना नहीं है. फिर केमिस्ट क्या करता है, जो उसके पास नहीं रहता है वो दवा बहुत डेंजर रहती है. सो बोलता है मेथिलफेनेट लेना ही नहीं. सो मेथिलफेनेट शुरू करने के पहले हम एंटीबायोटिक को जितना काउंसलिंग नहीं करेंगे उससे 10 गुना काउंसलिंग मेथिलफेनेट के बारे में करना पड़ता है बिकॉज इट कम्स विथ लॉट्स ऑफ इश्यूज एंड स्पेशली द एडिक्शन लायबिलिटी इज वेरी इंपॉर्टेंट. The children may end up with headache, nausea, insomnia, sometimes a growth retardation. But if we are able to manage this side effect and pick up them early, methylphenidate is a miracle drug in ADHD. In developmental pediatrics, unfortunately, most of the problems are having no medication. But ADHD is one of the developmental disorder which comes with medication. So remember that. As compared to methylphenidate, atomoxetine is very easy to available, but uska result is bit lesser than methylphenidate. Atomoxetine is wonder drug when it comes to only inattention. Only inattention में then we can have other drugs like paracetam. यहाँ पे brain को again ये this works on this dopamine and norepinephrine uptake inhibitors and they improve the functioning of the brain. So these drugs can be tried as a milder inattention cases. But when it comes to atomoxetine or paracetam to be precise and all other things, they are not going to be useful when it comes to the hyperactivity child. Another which drug I have not written in this part is the carnosine. Nowadays very popular with L-carnosine. There are many brands coming out. But are they going to be the ADHD drugs? Unfortunately not. They will just cover the inattention part, the focus part, and that too in a very milder way. So we have to remember the most important drug in ADHD is methylphenidate and then atomoxetine. And I will request that methylphenidate, ye jara teddy kire, do ask people who are working in this field and using them regularly. But monitoring very easy in a pediatric population. आप अपने pediatric OPD में methylphenidate के results monitor करना ज़्यादा difficult नहीं है, and you can actually promote using methylphenidate in your own pediatric practice. मैं और आगे जाना चाहता हूँ बिकॉज आई डोंट वांट टू लुक एट इट एज ए डिटी. यहाँ पे आप मुझसे बोल के थके हुए. आई वांट अश्विनी टू जस्ट शी इज वेरी गुड इन दिस डाइट मैनेजमेंट विद हर क्लिनिकल बायोकेमिस्ट्री बैकग्राउंड. आई वांटेड टू ऐड सम गुड टिप्स अबाउट द डाइट मैनेजमेंट इन ADHD. अश्विनी.
At this outset, first I will like to thank all the stalwarts of Jaipur IIP to give me an opportunity to interact with you about this diet management in ADHD. So whenever parents comes to us and there is a sharing of diagnosis of different developmental disorders, as all of you know, the diagnosis of ADHD is the best diagnosis because the chance of cure is really high. So while Sunil prescribes them, as he has told just now, the different medicines, the next question that comes from nowadays quite common from parents is, can we skip some medicines? Is there some solution? So here comes my role, the diet management in ADHD. So usually I follow the principles, that is first is reduce the junks. Second is replace with the healing foods. Then repair with the healing supplements. And the last one is rebalance. and the rebalances with the probiotics. Now let's go ahead. So when we think of junks, the simpler thing is junk means the junk food that is there with the saturated and trans fats and the sugar and salts. All of you are aware as this picture is showing. All the burgers, pizzas, pastries and everything. This is full of this whole group. So the second group is ultra processed food, where is the refined like maida and all those things are used. Nutritionally inappropriate foods like prepared in the recycled oil, like the vadas and samosa pakoda, they are really good to taste. But if they're fried in a small quantity of oil, usually whenever it is the footpath vendors, they do it in the repeated frying in the recycled oil, and then the problem comes. There is the high amount of sugar, fat, and the salt. The another group is caffeinated, colored, or carbonated beverages and the sugar sweetened beverages. So if we suggest the parents to keep this whole group minimum, because the children can't listen nowadays. So at least to the minimum, then their hyperactivity can be controlled. And why this thing? So all these junk mnemonics food, they cause a spike in the blood sugar. This leads to hyperactive behavior, and when the blood sugar level drops quickly, the focus is dropped. So as a result, what we see is the with the junk food, inattention as well as hyperactivity. Now the second thing, replace. Replace and serve with the healthy carbs. As all of you are aware, the simple carbs, the list is big, soda, cakes and the cereals, the sugar, the fruit juices. But how we can tell the parents to replace them? The simple complex carbs like sweet potatoes, buckwheat, the lentils, the bananas, the fruits, and all this nowadays they use pasta, but tell them to use 100% whole wheat pasta, the brown rice, our Indian beans, lentils, and all the cereals from home. So, if they are used, the chances of all the problems of hyperactivity can be minimized. Now, the third thing, very important sentence, nature doesn't make bad fats, but factories do make. So here let's know which fats to increase. Good fats that come from avocados, salmon and walnuts, olive oil, but reduce the bad fats that come from fatty meat, cheese, ice creams and all the fried food because they contain the saturated and trans fats. Now here comes the role of omega-3 fatty acids. What does omega-3 fatty acid do exactly in ADHD? Usually in these ADHDs, membranes of the neurons is degenerated, so the serotonin is less. Serotonin, as all of you are aware, it controls mental activity and the mood. The receptors for the dopamine, they are malfunctioning, malformed. So dopamine is lower, synapses as well as dendrites, they are fewer. So as a result, you get this picture in ADHD. Here, when there is a eicosapentanomic acid deficiency, there is an increased neuroinflammation. So what we see is the hyperactivity. Docosahexaenoic acid deficiency, then there is decreased nerve membrane fluidity, signal transmission issues. So focus is lost and inattention. So what is the dietary answer? Flax seeds, a lot of nuts and seeds, sunflower seeds, sesame seeds, the almonds, avocados, and those for non-veg fish, salmon, sardine, and tuna. But a word of caution, these are the fish from the cold water. So our Indian fish, they are usually not from the cold water. So specifically if the parents are getting cold water fish and they are from non-veg family, then it can be useful. But what can be the other substitute for this omega-3 fatty acid deficiency? It's another is omega-3 fatty acid supplements. But how to choose it wisely? Why it is to be chosen? It is a mercury free option, it is a sugar free option, it is a gluten free option, and another thing which is very nowadays important one is that it should be with the non-genetically modified substance. So omega-3 selection should be done on these criteria. What are the important supplements? Zinc, magnesium, iron, and the B complex group. It is said that the 12 weeks of supplementation with zinc, it improves hyperactivity. So from dietary groups, you can suggest them fruits, the nuts, and the seeds. Similar is for the magnesium. So green leafy vegetables, the fruits, and the nuts and seeds. This reduces the hyperactivity. 12 weeks of supplementation of iron. Usually iron, we can suggest simpler things like dates, the jaggery, the green leafy vegetables. This helps to improve at least the restless leg syndrome. That is the research that is saying. And the B complex group of supplementation. it helps to improve the hyperactivity and impulsivity. So these are some of the very simpler things which you can add on in your routine day-to-day pediatric practice. Just one point. Now the last is a rebalance with probiotics. Now it is commonly known there is a we all are aware there is only one brain in the head, but there is one more brain in the gut. And if the brain is not functioning properly, gut is disturbed. And if the gut is disturbed, brain is equally disturbed. So here it is the syndrome which is told is the leaky gut syndrome, which is seen in many developmental disorders. So let's heal this leaky gut. So what actually happens is in these ADHD children, commonly constipation, GI irritability, a lot of issues are there. The many a times candida overgrowth is seen. There is a gluten casein digestion issues. So probiotics, what do? They improve digestion and relieve these symptoms. They correct the food sensitivity, especially with the gluten and casein, and they correct the bacterial candida overgrowth. As a result, aggression is reduced, anxiety, agitation is reduced. It can be simply supplied through simple buttermilk and several other food supplements like dhokla, idli, all those are Indian foods. But we have to just tell the parents to include them in the daily diet, which nowadays parents forget. Otherwise, the marketed products for probiotics as well as sunil omega-3 fatty acids, they are available.
Yeah, but thank you, Ashwini, for talking about it. We can talk about diet over here a lot, but I want to remember one very interesting thing is here. I want you to go back to the traditional Rajasthani diet, and you will understand the traditional Rajasthani diet with that big charge associated with your every plate of meal, and that is where these probiotics are corrected. So the traditional, let's go back to the traditional Indian diet and avoid the junks, and that is one other part. But is diet the only part of management? No, it is one part of the thing, but that is the time a pediatrician can be a very great help to the mother because the market is flooded with lots of dietary ideas, and we need to be very careful while selecting the things. And again, tell the parent that these supplements or probiotics or are they going to correct the disease? They're going to help the parent, the child, to do better with the things, but not to reduce the complaints altogether. With the diet part in the now, let's go ahead with the IEP part. What is important? We should tell the parents. कॉमन मेथड क्या होता है, ये बच्चा ऐसा ही पगला है, ये घूमता ही रहता है, एंड ऐसा करके वी आर एक्चुअली unfortunately I have seen kids who are intelligent, they're very sharp, just because they're not, their ADHD is not vanished, they're lost their academic path. So teach the parents about the thing, and for an adolescent, talk to the child that this is your problem beta, there's nothing wrong in you. If the child is bullied, the child is depressed, उसको बोलना पड़ेगा ये एक और एक बीमारी है, and we can correct the disease, and that is how the thing is. These children require a discipline but not a punishment, and that's why following a calendar, a classroom management techniques are all useful in the IIP. While the summer program is very interesting, before the school starts, if the child is taught about the next year's program. अभी कोविड के एरा में आज के भी तो सीखना नहीं हो रहा है, तो आगे का कैसे होगा इज अ डिफरेंट इशू. बट फॉर एडीएचडी अगले साल का अगर पहले शुरू किया, दैट इज कॉल्ड एज समर प्रोग्राम, दे डू वेरी वेल. दे रिक्वायर 1-to-1 टीचिंग, क्योंकि टीचर बोलते हैं और 40 बच्चे पढ़ते हैं, इसमें एडीएचडी का बच्चा पढ़ नहीं पाता. बट व्हेन इट कम्स टू 1-to-1 टीचिंग, द चाइल्ड इज इंटेलिजेंट, उसके साथ में टीचर ने बैठ के उसका दिमाग को शांत रख के फोकस करके उसको सिखाया, उसके लिए कोई प्रॉब्लम नहीं. So ADHD children, in spite of good IQ, they require hand-holding, and that too for a long time. I have seen children, they require hand-holding right up to 10th and 12th standard, and it's still okay. There's nothing wrong to help these kids with the hand-holding, because that is going to take care of a beautiful future for them. That is about the IEP. Yeah, classroom accommodations, what we can ask the teachers to do, the children should be given a clear written and verbal direction, that too not a big list. Scheduled organization, again I'm telling the calendar part, the check-in times, giving extra opportunity. ये बच्चों को मूवमेंट, उसको सबसे अच्छा काम क्या रहता है, उनको क्लासरूम मॉनिटर बनाने का. तो फिर टीचर को कुछ डस्टर चाहिए चल लेके आ, चौक चाहिए चल लेके आ, टीचर को दूसरे टीचर को इन्फॉर्म करके आ, इनको इसके लिए दौड़ा दो. लेट द चाइल्ड मूव, ही विल बी द बेस्ट पर्सन. कंसिडर द फ्लेक्सिबल सिटिंग ऑप्शन, उसको पर्पसफुली उसकी जगह बेटा बताते रहो, ही विल बी फाइंडिंग इट बेटर. उनको बड़े बड़े प्रोजेक्ट्स मत दो, उनको छोटे प्रोजेक्ट दो जो उनसे कंप्लीट हो जाएंगे. गिव वन मोर. सो चंक group them in the different things, and you'll find that the same long term project can be done into smaller pairs, and that's 17. उनके हाथ में कुछ फिजेटी चीज दे दे, फॉर एग्जाम्पल फिजेट बॉल रहता है, कुछ सॉफ्ट बॉल ऑफ प्ले टॉयज रहता है, दैट ऑल फिजेटी टॉयज आर गोइंग टू कीप दिस चिल्ड्रन एट वन प्लेस. तो उनको सेंसरी मैनेजमेंट अच्छा रहता है. उनका वर्क स्टेशन हर टाइम अरेंज करना, दे आर डिसऑर्गेनाइज. सो आस्क देम टू डेवलप दैट वर्क स्टेशन इन अ ब्यूटीफुल वे. उनको अपने चीजें जो दिमाग में आता है उनको लिखने को बोलो, क्योंकि ऐसा ही कोई एडीएचडी बच्चा आगे जाके कुछ इंटरेस्टिंग करने वाला है. एंड टीच एंड प्रैक्टिस प्रेडिक्टेबल रूटीन्स फॉर दिस. एंड अबव ऑल आई वांटेड टू ऐड वन मोर थिंग, एंड दैट इज कॉल्ड एज द ग्रीन्स एंड ब्लूज. ऐसे देखा गया है कि एडीएचडी बच्चे, इनको अगर नेचर में लेके गए, फॉरेस्ट में लेके गए, ट्रेकिंग को लेके गए, दे बिकम क्वाइट काम. ये बच्चों को स्विमिंग, पानी के साथ खेलना बहुत अच्छा लगता है, एंड दैट विल काम देम. एंड वन ऑफ द बेस्ट एग्जांपल ऑफ दैट इज, इफ यू आर अवेयर ऑफ माइकल फेल्प्स. माइकल फेल्प्स जब बोलते हैं तो वी नो दैट इज 8 और 7 टाइम ओलंपिक गोल्ड मेडल विनर इन स्विमिंग. एंड इसकी स्टोरी भी ऐसी है कि स्कूल ने निकाल दिया था उसको, मम्मी ने फ्रस्ट्रेट होकर उसको स्विमिंग को डाला, एंड उसके जो फ्लैपी लेग थे उसने कमाल कर दिया. एंड माइकल फेल्प्स को हम ध्यान में रखते हैं, और हम लोग डॉक्टर्स को कोई याद नहीं रखता. Michael Phelps is ADHD, but he has made the history. So that means that these children are having capabilities and we can help them. The behavioral intention part, इनके behavior भी problem रहता है. And the best part is cognitive behavioral therapy. Instead of going to the whole rut of what is cognitive behavioral therapy, I want you to understand, teaching them about the self-control, the ABC, the antecedent, the behavior and cognitive part of it, the consequence part of behavior, that is one thing. Compensatory strategies, and time is limited, but CBT is one thing which these children require while managing ADHD. So, what is the conclusion of all these therapies? Selective use of medication and long-term behavioral therapy gives the best result in ADHD, but for a long time. Along with that, we need to work upon the IEPs, a good quality diet with all those supplements of omega-3, vitamins, and junk avoidance, and that is going to give you a good result, and these children can do really good in the life. So, in summary, the first thing we should remember is highly prevalent brain-based, 5 to 10% is a big number. Brain-based disorder, it is associated with lifelong impairment in functioning. सेकंड पार्ट टू रिमेंबर इज एनवायरमेंट फैक्टर्स कैन कंट्रीब्यूट. तो पूरा घर का अगर माहौल खराब है तो दीज चिल्ड्रन आर गोइंग टू बिकम मोर प्रॉब्लमेटिक एंड लैंडिंग अप इन मोर सीवियरिटी एंड कोमॉर्बिड कंडीशंस. Stimulant medications like methylphenidate along with behavioral therapy is a good combination to manage ADHD, and reducing junks and supplementing with omega-3 fatty acid just help these kids to just behave better in their future. So to see more such videos, please subscribe, like, share our YouTube channel Chiranju Godbole at YouTube. You can also visit our website www.chiranjugodbole.com for more information. You can contact 9637641404 for appointment between 9 to 5 p.m. Thank you.